Hello, and welcome back to the Wishing You Well podcast. We're your hosts. I'm Amy Albero, founder of Revive Center for Wellness.
And I'm Catherine Van Eyck. We're both licensed therapists and wellness enthusiasts.
We know how overwhelming it can be to figure out how to navigate your wellness journey.
So each episode, we hope to bring all the pieces together to help you figure out what fits best for you. This week on Wishing You Well, we're discussing rehabbing and preventing injuries, as well as managing chronic pain. And we're joined by a special guest who also happens to be my husband, Dr. Brett Poniros. Brett is a chiropractor and strength and conditioning specialist. He is the owner of Apollo Performance Chiropractic, a sport and performance rehab practice located in Pleasantville, New York. Brett's practice focuses on the treatment of athletes and active individuals of all ages, with subspecialties in rotational athletes, tendon injuries, and the bridge management of post-operative cases. One of his other interests includes longevity science and how building good habits centered around mental health, nutrition, sleep, and exercise can increase performance and quality of life. Before we get to our chat with Brett, we have some announcements.
Have you been watching Reactivity TV? Odds are whatever trending show is out, we have been all over it with our therapist perspective. Every week, Catherine and I commentate on trending shows like Succession, Love is Blind, and really any show that you're watching, odds are we are watching it too. There is so much to watch, and we're always looking for suggestions on what we should cover next. So let us know what you want us to give our therapist reactions to by emailing us at wishingyouwell@revivecfw.com. And don't forget to check out our YouTube channel where you can catch all the episodes of Reactivity TV.
Reactivity TV, plus lots of other yummy, delicious things like nutrition videos from our dietitian, Elizabeth, as well as provider spotlights where we talk about different therapists each month and more. Lots and lots more. So definitely check out our YouTube channel. And overall, just thank you so much for being here. Thank you for being a listener, a viewer. We are really appreciative of that. And thank you for following and rating and reviewing us. We love your feedback, and we love having the opportunity to provide all of this information to all of you. So please continue giving us all of those ratings and reviews. It really helps us. Thank you.
Okay, let's get into our episode.
Living a full and well life is put together, authentic.
We feel it.
Take care of ourselves.
Hello, Brett.
Welcome, Brett.
Hello there. No, thank you so much for having me. I'm obviously, I'm super familiar with the practice. I kind of have somewhat of an insider's view. So I love what you guys are doing over there, what you're trying to accomplish in terms of holistic health. And I'm excited to talk about sort of the rehab and pain aspect and sort of the bridge between even the two of those in some regards.
Oh, sure. I mean, I always enjoy talking to you. You're one of my favorite follows on social media. I feel like you give such really practical, advice. I don't even know if that's the right word for it, but I feel like I save every one of your videos. So I'm so happy that you're here, because I feel like in the way that you work and the way that you practice and just the way that you think about things, you really value mind-body connection in kind of all that you do. And so it feels like a nice synergistic chat today.
I think it will be. And I see so many parallels in the way that, at least I know that you two handle mental health and how you handle therapy sessions to how I like to approach rehab and pain management as a system. So I'm really excited to get into that. And I appreciate the follow on social media as always. All those tips usually come from questions from patients. So that's how I design them. So most of them are actually questions that people ask me. So I figure if one person's going to ask them, multiple people might.
Yeah. Well, I think I need to caution myself or temper myself today, because I feel like this whole episode could turn into all the questions that I have for you. And so if we don't get to those, I'll be sure to look for a question box on your social media to look up.
Every family gathering is basically, hey, just people pointing to different parts of their body and asking questions. So it's nothing that I'm not used to, that's for sure.
Readjustments for life with the different family members.
A perk, I'm sure, being of this marriage.
Yeah. But they always do say the hardest people to help are the ones close to you.
Oh, sure.
Well, one question that we ask everybody, that all of our guests, is what does living a well life mean to you?
Yeah, I was No, I was obviously prepared for this one a little bit. So to me, it's really setting up the habits and systems that allow you to frequently access the healthiest and then the happiest version of yourself. I think that kind of encompasses, the idea that we're all going to have down days and that everybody is different. Everyone's at a different stage in their life. But I think that if you can sort of be the best person that you can be and frequently access that version and continuously work on it, then I think you're living a pretty well life if you can do that.
I like the system. We just had a guest on here who talked about roots in a tree, and I feel like that just relates really well.
Mm-hmm.
Yeah, I think I've just started to realize the importance of systems, especially not only from the personal side of things, but from the business side of things as well. When you're kind of just shooting from the hip, you don't really know what's working. And then at the same time, it's really hard to create consistency. So you try and just stick with a routine, a system in place, and then evaluate it and then go from there and see if it's working for you. And you can always change it up as you go through.
Mm-hmm. I have to say, I feel like across all the guests that we've had, that's been such a consistent area included in wellness is that evaluative aspect of it, that you create something and then you have to reflect and see how it's working and what adjustments need to be made. And it seems like if I've learned anything about wellness, while we do know it's not a one size fits all, it seems like that is really consistent. And so I'd love to know a little bit more about what systems are we even talking about here? Can you give us an example?
Sure. So, from the health side of things and in the way that I would practice, I guess I look at the system in terms of the actual anatomy and the body systems. The knee is an individual joint, but it functions in tandem with the ankle and the hip. So from that perspective, I'm looking at the body as a system. And so if I'm evaluating somebody and trying to create a plan for them, each time they come in, I don't want to just totally go on a random tangent. I want to have an idea of what I'm going to try and attack. I'm going to give them their home care and things to do on their own. And then we're going to continuously try to build and evaluate on a week-to-week basis on if we're seeing improvements. And that might include having them integrate some other habits into their own personal systems at home, meaning like a bedtime routine could be a system for you, a way that you get ready, a way that you start your day or end your day. So I just kind of try and create these little habits within people's lives that are not only easy to implement, but then I think are going to have, I guess, the biggest bang for your buck, so to speak.
Mm-hmm.
Brett, you and I have talked about this before, where you've described that to me about how you treat and how you look at not just, the joint that somebody might be experiencing pain in, and that's where our two professions really cross over each other. I feel like, when Amy and I see clients, we're not looking at the individual and a symptom that they're experiencing. We're looking at them as a system. We're looking at their systems that they're a part of. We have group supervisions all the time where we're talking about systems and whether that's a family system that somebody's a part of or the greater macro systems that they're a part of. So it's kind of cool how those weave together.
Mm-hmm.
Oh, it's incredible. I think we talked about this as you were even going through school as well. And it's just, there's such a crossover. I think, honestly, it's so refreshing because I think that most people, this is what they miss from, and I'll put in quotes, the medical system. And I never want to, talk badly about a profession. I'm just talking about the way that the current system, so to speak, works, is that it's very hyper-focused on the issue and the diagnosis. But to me, I can give someone a diagnosis of, even if it's like something like non-specific knee pain, right? Most people think that, if there's pain in my knee, it must be a meniscus or a ligament. So, a piece of cartilage, something. That doesn't have to be the case. You can have, if you go get an MRI, you can have knee pain and still have, or an X-ray for it, you can have knee pain and not have anything structurally wrong with you. So where do you go from there? That's where you have to start looking at, again, the entire body and where something might be dysfunctional. It might be happening over here, in the top left corner, but the result and where you feel the pain are actually happening down in the bottom right corner. Mm-hmm. So that's where it's fun. It becomes a puzzle. You really have to sort of take into perspective the person's life, what they're doing and what their goals are as well going forward.
Yeah. Well, can you tell us, you're starting to share a little bit here, but can you tell us about your specific way of practicing or your philosophy when it comes to rehabbing injuries?
Yeah, of course. So I am a chiropractor by training, I guess you would say. My background is in strength and conditioning, and I've just been involved in competitive sports pretty much my entire life. So that's sort of how I worked my way into this profession. How I deal with pain and rehab is, I guess I would say, a little bit unique. I sort of would say I'm the combination of a chiropractor, strength and conditioning coach, and a physical therapist, in the sense of I don't traditionally just treat problems with the neck and back. I do use manipulation or adjustments that, all the viral videos on TikTok, or people are probably incredibly familiar with that at this point. But that's only a piece of what I do. I really incorporate movement into my practice. And then, like I said, I'm going to talk about sleep. I'm going to talk about nutrition. If someone comes in with chronic pain and they've been sleeping 5 hours a night for the last 6 months, I might not even do a whole lot of movement with them. It might just be drilling habit formation around getting a full night's sleep and see how that ends up progressing over time. So I like to say I'm almost a little bit of a chameleon. I try and match my skill set and the broad array of skills I've tried to and continuously try to develop to the person that comes in and what they need and what they might be looking for.
Mm-hmm. Yeah. When like, I think the general public hears like chiropractor, they think, okay, lay face down on a table and someone's gonna, perform an adjustment. Right. And I've had an experience with a chiropractor that kind of had a similar philosophy as you. And that kind of blew my mind that there's so much more to healing and improving functionality that can be helped through a professional like you, which I really, really appreciate.
I think it's a bit of a blessing and a curse of the profession is, I have the freedom with my degree and the knowledge base and the training to go in so many different directions, as do all other practitioners that graduate with the chiropractic degree and the physical therapist degree as well. But I think societally, and because a lot of the training is in manipulation and adjustment, that's how people perceive the profession. And that's how a lot of chiropractors carve out their niche. So it's a daily struggle for me, not only with people calling into the practice, but trying to convey that to other healthcare providers that, yes, I do handle post-operative ACL or, like knee, elbow, whatever shoulder cases as well. But I will take, of course, the person with low back pain. The treatment and frequency and duration of treatment just might look a little bit different than what people are used to if they were to walk into what I would say would be a traditional chiropractor's office.
Mm-hmm. Mm-hmm. One question I've thought about DMing you, just again, asking for myself, is like, how do you know like what you need in terms of a practitioner, whether like, how do I know if I need a physical therapist or maybe it is more strength based, or maybe it is chiropractic? Like how does someone know who to see?
It's a great question. And it's honestly my belief that there are so many overlaps between the physical therapy, the chiropractic profession, even the athletic training profession. That profession, if anyone's played sports here, they, like the athletic trainer at the school, they're moving into a master's program. So it's not just going to be an undergrad degree. There's so many overlaps that I really do think that within the next decade, there will be just one musculoskeletal rehab sort of professional. My honest recommendation to you, because people practice so differently, is find a place that will align with what your goals are. If you're an active person and you think you need an active solution, then, call around and just see. Most people will be willing to talk with you, but there's so much blending within the professions that it is tough. Now, overall, I would say I'm somewhat of an outlier in handling post-operative cases as a chiropractor, so I would say physical therapists, that's typically their niche and wheelhouse. But besides that, if you just have general aches and pains, there's such a broad spectrum of people you can go see, and you can see a really great chiropractor or a really bad one, and you can see a great physical therapist or one that doesn't align with your values. So just like anything else, it's just about finding a fit and being patient, I think, and just being able to ask the right questions.
Mm-hmm. Yeah. Similar to therapy too, sounds like.
Absolutely.
Mm-hmm.
So with the different ways that you treat people, I assume that when people end up coming to you, okay, I know, but when people end up coming to you, they're probably pretty surprised with the way that you work, what kind of surprises them just in general about the rehab process when they do come through your door?
That's a good question. I think I do have, I guess, two different types of patients. The ones that come in from word of mouth, like you guys would, that kind of maybe they know, maybe they seek me out because they know it's going to be a little bit different. But then to answer your question more directly, I think people that have been dealing with pain for a long time, I used to be when I was younger in practice and a little bit more, I don't want to say naive, but maybe just I wanted to help people so quickly. And I would say, like if we find the root cause of this, like it could take 1, 2, 3 visits. That's still the case. It really is, but with very few. And I'm upfront with people to say, if you want to make a physiological change, if you want to really change a movement pattern, change your brain's perception of pain, of what's going on, it takes time and it takes effort. And that doesn't mean being in my office 3 times a week for 3 months. It might mean just checking in, but you have to work at it. Talking about another overlap with therapy, right? I mean, it's these things that just because you show up for 1 hour a week doesn't grant you the it doesn't give you the right to feel better. You have to put in the work. And I tell people that I'm very upfront with them with that. And I said, I'm going to put in the work to help guide you as best I can, but this is a you thing as well. And I think most chiropractors that I've even seen in the past, they almost make it seem like the more you see me, the better chance you have of getting better. And I don't necessarily think that to be the case. I think some people need a little bit more guidance than others, but I really try to encourage people to take control of their life, because when their plan of care is up and they're no longer seeing me, what's going to happen? Are you going to revert back and experience the same sort of symptoms, or are you going to be able to take control of it and know what to do if you have a flare up, or even know what to do to prevent a flare up?
Mm-hmm. Right. So it is a true rehabilitation model. Like you're really trying to help people kind of gain the practices in order to essentially prevent things from happening in the future, or just to continue to heal.
Yeah, exactly. I think that's always my goal from the get-go is to help people help themselves at the end of the day. And I always ask people, and inevitably someone's coming in most likely with pain, but I always ask in my intake form, what is something else about your health that you want to address? Is there something in there? And I give the options of sleep, or maybe it's cholesterol, or maybe it's weight gain or weight loss, depending where they're at. And we just talk over the course of time, just trying to implement these little habits that will help them do that over time. And eventually the goal is, like you said, to just have them be comfortable making decisions on their own, be comfortable walking into a gym and knowing what machines you could use, or how to create a workout for yourself around what you may have been dealing with or what you may be trying to prevent.
So you really want to give them the tools to figure out how to do it for themselves and keep going themselves.
Yeah, I think, and that might take longer for some people than it does the other, because some people, if you've been dealing with something for a really long time, it might take a bit longer to figure out. Or people that don't have a training background, if they feel uncomfortable doing certain exercises, if they've never resistance trained. But I believe that really is the best way for them to go forward. It's going to take time. And the key is just not overwhelming people. I think so many people, it's like the issue that I have with New Year's resolutions, right? Is you just have this blitz approach, and you're really motivated in the beginning. And then it just like when the motivation fizzles out, you have nothing left. And I know that you guys have talked a decent amount about motivation and how you can't just rely, because the motivation isn't always going to be there. But what will always be there is a system, or if you really internalize the type of person that you want to be. If you say, I want to be a healthy person, on those days where you're feeling down, just depressed, low energy, in your heart of hearts that, okay, and the person that I want to be would still go to the gym. And I'm not saying there's anything wrong with taking a day off, but I think in the aggregate, that's how I try to help people frame their thoughts and sort of, I guess, mold their persona as to when they leave my office eventually.
Mm-hmm. Well, it also sounds like another overlap here is, like, I know for us, and I imagine the same is true for you too, Brett, that like when people call seeking therapy, they're at their most vulnerable, right? Like for whatever reason, they've hit kind of a quote unquote crisis point, and they are like, all right, just help me now, help me fast, fix it for me. Like, I want to feel better as soon as possible. And so like a lot of like, it's very cliche to say like, therapy is a process, like it takes time, like patience is really so much a part of that. I imagine for you too, people aren't coming to you and they're feeling awesome. Like they're coming when they might want something to shift or change. And I imagine patience is part of the process for you too.
Yeah, that's such a great point and there are the instances where for instance, if I see a high school athlete that twisted their ankle on the field, that's a different story. But I often tell people where they have this sort of insidious pain that for no reason, they've been running 5 miles a day for 5 years and all of a sudden they have knee pain and they can't pin as to why. And I always tell people pain is often the last thing to come and the first thing to leave. It's not that difficult for me to find some sort of modality to just decrease your pain. That adjustments are great at doing that. So I just tell people, just because your pain is gone, don't think that this whole process, this whole journey is over. And I think it's probably in a similar situation to how you deal. Like you said, if someone comes to you with a crisis, they might just from talking to you feel better in a few sessions. But that does not mean that the underlying cause of why that rose to the top in the beginning is even close to being handled. So yeah, I think the quicker you can lay that out in the beginning and just have people understand and buy into that, the better it sets you up for the long run and for the outcome that person's going to eventually get over time.
For sure. So preventative care wise, like I feel like that's an important area for us to spend a little bit of time on, especially when it comes to physical injuries. Like, where might we be missing the mark there? I
think when it comes to preventative injuries, like this is almost how I train now myself, is I basically, and people think it's funny because I'm 28 years old, but I basically say like, I want to be a badass, like 80-year-old or 90-year-old. And in order to do that, you basically have to have a preventative mindset of training. And the way that I describe it to people is just being a well-rounded physical person. So sprinkling in aspects of cardiovascular health, sprinkling in aspects of flexibility and mobility, but then, and also, and this is where I think most people don't realize the benefit of resistance training. And I'm not saying that because, I have a background as strength and conditioning coach. There is so much data and literature that support not only increases in lifespan, which is the actual years that you're living, but health span as well, which is the quality of the years that you're living. The correlation between strength and muscle mass and health span and lifespan are incredible. They say in sports that there's a saying, winning is the ultimate deodorant, meaning you can have a horrible locker room, you can have terrible relationships within the team, but if you're winning, it kind of gets masked and nobody cares. I basically adopted that and just say that strength is the ultimate deodorant in terms of pain. If you are a strong, physical, capable person, you can prevent a lot of injuries, soft tissue injuries, joint injuries. And again, I don't want people to misconstrue. That doesn't mean all of a sudden you have to be some meathead trying to deadlift 400 pounds. It just means challenge yourself, on a 2 to 3 times a week basis. And that can look different for everybody. That can be Pilates, that can be weightlifting, that can be body weight exercises close to fatigue or failure. But overall, I just think that because of maybe a lack of knowledge, and also some people are just scared to go into like a gym setting, that's the one thing that people don't do that I think could be really, really helping them going forward.
No, I mean, you're so right in that people can get hyper-focused on a lot of different health and wellness pathways, but if they're not targeting strength, they're missing a huge component of it.
I think you could probably speak to even just when you got introduced to strength training and what that did for, I'm sure, confidence, but it just changed a lot of things. And again, I obviously know this. I'm not going to pretend that I don't know this, but you had dealt with certain like mid-back pain, and the second you started doing, ironically, heavier back exercises, that pain started to melt away. I often just say strength creates stability, and instability is what often leads to injury and pain. So if you're just really, and it's counterintuitive because you think, okay, if my knee hurts, why would I squat? But I can from experience, it's what almost all you do all the time is you simply acclimate people to loading that joint. And a lot of times it'll go away. So I think the other thing I can harp on here is that pain is, yes, I would describe it as a little bit of an alarm system, but it's not an alarm system in the sense of don't move, don't do anything. You're just going to go down a spiral if you go that way.
Well, Amy, I feel like you know this too, that sometimes I just wake up and I just slept the total wrong way and I can't move my neck. And the last thing I want to do is any sort of upper body exercise. And what does Brett program for me is upper body exercises.
Neck and shoulders.
Like, I don't want to deal with this neck. And he's like, that's what you have to do.
Mm-hmm. Yeah.
It's almost like exposure therapy. I literally tell people like what you're doing is exposure therapy for your body. And that's not everybody. Like I again, there's always caveats. And like, I hate to be that person and just say, it depends. It depends. I'm not saying, you pick something up, you feel a pop in your back. Don't go just try to pick some heavy stuff up, see somebody. But a lot of the times, if you're dealing with these little nagging aches and pains, just movement centered around that area can do wonders for it.
Okay, let's talk about like the other end of the spectrum here, which is more where I fall. Is like I have like I was in preparation for this conversation today. I was like thinking about like some of my like nagging aches and pains, but like they've been nagging for like years. And so like for the people that are like like that's fine, like I'll like ignore it or like I'll work through it. Like can you speak to me? Here, like I know, I mean, so much of what we talk about here that I know intuitively, but like don't internalize is like pain is our body telling us something. Like our body communicates to us all the time. I'm really bad at listening to it, but like, I guess like in this case of like it's probably fine. I'll just keep moving. Like, what do you talk some sense?
Well, let's be honest. I mean, I can relate to you in the sense of, I know you're a business owner. And so at the end of the day, like the pain that you feel is probably like number 12 on your list of 50 things. Maybe even it's like number like 46 on your list of things that you have to get done. And so that's where, and honestly, a lot of the people that I end up working with are people that have either tried things or have been dealing with something for a long time. That's where I think going into more of like a nitty-gritty evaluation. So we'll just use the example of back pain because it's something that everybody can relate to. The first thing you have to do is figure out, okay, is there some sort of pattern that I can say, I know when this pain is occurring? Then you pinpoint, what do the mechanics of that movement look like? So for a lot of people, it's like, hey, if I sit for a long time, I get this pain in my low back. So then I kind of walk them through, okay, well, when most people are sitting, their sort of tailbone is a little bit rounded. So they have a little bit of a round in their low back. Maybe you're sensitive to what we would call flexion or rounding of the low back. So we kind of devise a program to have mini movements throughout the day that promote the opposite, that promote extension, and see how that works. And now if that provides some relief, then what we have to gradually do is get that person more comfortable moving into the trigger of their pain, which is flexion. So it's this sort of back end approach of backing away from the trigger and then moving back into it through mini exposures. Now, if it's something a little bit more dynamic, like I get back pain, but only when I squat, when I'm doing squat workouts, then you start to look at more of the system and say, okay, what does your hip mobility look like? Is there one hip that's not rotating properly? Is there one ankle that's not going into as much range of motion as it should? And that's where I believe in really sort of targeted, poignant home exercises around one thing. Because if you just throw the kitchen sink at it, you're not really going to know what's going on. But at the same time, someone might not have an extra hour in their day to do this elaborate routine. You just need to build in these little things to help try and make the biggest difference that you can.
Mm-hmm. Mm-hmm. No, that makes a lot of sense. As I like hold my head up because my neck hurts.
Neck and back exercises, neck and back.
And so, sorry, I took us a little bit off course. Like I said, I'm so excited you're here. I have all these, personal consultation questions for you. But one of the things that you just talked about is, strength training being really, really critical and really important as it relates to our longevity. And can you tell us a little bit more about how that might come into play in a larger sense as well?
Yeah, absolutely. I think so. When you're strength training, you're trying to do two things. You're obviously trying to promote strength and your ability to say, and this is most easily noticed in an older population. And I think younger people take it for granted just because your muscle mass and strength will slowly deteriorate if you do nothing on pretty much a linear or even almost like an exponential curve. But just the ability to do what you want to do, get down onto the ground, pick something up, be down on the ground with your kids or grandkids, and really fall prevention. I mean, there are some really staggering statistics about falls in the elderly, like a broken hip after the age of 70. It's something like, I want to say 70 to 80% of people that suffer broken hip will actually be dead within the next 5 years if you're over the age of 70 or 75.
Wow.
So I know younger people don't think of it in that sense. A lot of the strength training is largely built around how I look, how I feel, and there's nothing wrong with that whatsoever. But when you're talking about the real benefits down the line, you're basically trying to slow down as slowly as you can, because we're all going to slow down. We're all going to lose our strength, our muscle mass. It's just how slowly can you delay that process, essentially. And then, I'm sure Elizabeth has talked in some capacity, at least, about strength training and how that can affect metabolism, and skeletal muscle being a huge sink for glucose and blood sugar. And with diabetes being on the upswing in this country, the more muscle mass you have, the more that your body is able to take those sugars that you ingest and convert them to fuel instead of storing them as fat, or instead of taxing the body in terms of insulin resistance and all those things that eventually lead to diabetes, obviously, without getting too technical. So again, it's just in terms of bone density for women, I can literally talk about this all day. I would just say to people that are out there, consider doing it. And there are gyms that have really friendly atmospheres where you can learn on just machines. You don't have to go up to a barbell or dumbbells and do anything crazy. You can really start simple and move on from there.
Mm-hmm.
Well, I mean, I think you touched on something there, that there is such a fear, and especially when it comes to women, there's such a fear sometimes in not really knowing what to do. Or, I mean, I remember when I was in college, but also college clients of mine that don't want to go, like, quote unquote, downstairs at the gym because that's where all the workout bros are, and that's where it's really intimidating, and they don't know what to do. Mm-hmm. And there aren't a lot of, or there haven't been a lot of education just for strength training in general. There seems to be a lot of just like a lack of education that, I mean, where could we be getting that? I don't know. In high school, that we're not getting in our gym classes. Before we venture out.
I do wish that physical education would get a little bit more remodeled. And, I think it used to be a little bit more centered around the actual education of anatomy and what you're doing and exercises. But I think that would be a really good start. I know there are certain, whether it's doctors or schools, that do have programs that will teach anatomy, will teach basic exercises, just exercise for muscle groups. But I agree with you. Most people don't do it because I don't think they truly know the benefit of it. It's one of those things where it's a no-brainer, but it can also be really empowering to just move something like that. It's not necessarily for everybody, but I think people giving it the time, it can be something that's like, really people start to gravitate toward. And I see it every day where people don't strength train, and we come in here and we acclimate, and even just pushing like a sled or pushing some heavy weight, which is a very safe exercise. Everyone always seems, they're like, wow, I never thought that I would really like this, but it's something that really makes me happy. And it's something you can hang your hat on.
Mm-hmm. Well, you mentioned, like, as you were kind of alluding to Catherine's experience, that like there is, because strength training is like progressive, that you can actually see and build on strength training, or whether it's adding more weight or if it's, I don't know, like Pilates and like increasing the time that you can hold a plank or something like that. Like, it is so amazing in terms of what it can do to kind of confidence as well. Like, in that way, I imagine it contributes to longevity as well, like the mental and emotional benefits too.
Right. And there are actually really good studies out now that are showing in mild depression and anxiety, exercise, whether it's resistance training or cardio training, being as good, if not better than the leading medications. Now, again, mild anxiety and depression. In my scope of practice, I'm not really giving advice on medication. It's not within my scope, even over the counter medication. But I always just sort of remind people that there are far more benefits to exercise than just the actual, calorie burn that people think of. It goes way beyond that. In fact, I think that like the calorie burning of exercise is the least important effect. If you work out for an hour pretty hard, maybe you burn 400 or 500 calories. I could go eat a bag of chips 20 minutes from now and just see you later, gone. That's, to me, that's almost the least important effect of exercise. It's everything else that you're getting that is really providing the most benefit for you.
Mm-hmm. I have a client who really has such a positive relationship with exercise and movement beyond the physical, the aesthetics. And one thing I have it written down because it's a good reminder for me too. And she says, exercise is like water for me, as essential to my well-being as water is exercise is that for me too, because of just what you're saying. It's so additive in so many ways.
Yeah, I think I can speak to this from a personal note as well. I mean, and there are extremes of it. Obviously, I went through extremes of it through college and whatnot, really almost using it as, if I don't do this thing, it's going to ruin my day, ruin my mood. I had a similar relationship with food, honestly, to tell you the truth. And it's always striking a balance and just understanding that it is a way to push yourself, but not to let it define you. I think athletes have a specifically hard time with that. And I see a lot of athletes in here that when they, tear a ligament in their knee and they know they're not going to be on the field competitively for a year, the things that it does to their mentality and their psyche is, again, almost just as bad as what has happened to their body. And so that's where the mind body sort of comes into my field. Obviously, I'm not doing therapy with my clients, but at the same time, I have to sort of structure their plan and take into effect that this person not only hurt their knee, but their identity just completely changed, or at least the way that they view themselves. So I'm always thinking about that. And someone that's a runner that truly identifies as a runner, what would it mean to them if they couldn't run a year from now? Mm-hmm. And to that person, it might be they can't see their life without that. So there's way more at stake in a lot of the care that I do besides just getting someone out of pain. It's really sort of saving identity and helping people remain who they are or who they want to become.
Oh, I have to say, I was an athlete growing up, and I was a pitcher for softball. And right before opening, the opening of the season, I broke my middle finger on my right hand, on my pitching hand. And it was meant to be a big season for me. I was a sophomore and I was starting, and it was a big deal. And so, I'd grown up as an athlete. This was something I was working toward. And I was crushed. That was my entire social life, livelihood. And I wish that I had support, as someone like you, because I feel I was just told essentially ice your finger and we'll see what happens next year. And that just wasn't what I needed in my plan of care, or all I needed, I guess, in my plan of care.
No, it's a really good point. And I think even something that I try to do in some of my post-op cases early on is if someone's, for instance, is rehabbing their elbow, a classic ligament that's torn is in the elbow for pitchers, for those that don't know. And even while the person is still in a sling, what I'll have them do is come in here and do really hard training for their legs, just so that they can maintain that competitive nature and feel like they're still pushing towards something. Because it can be a long, lonely process if all you're doing is showing up and just straightening your arm for 30 minutes over and over. It's really hard to see the light at the end of the tunnel. I had a similar experience to you. I had the misfortune of really injuring a hamstring twice when I played college baseball. And I remember literally breaking down on the field after the game was over, just knowing that was pretty much the end of my senior season. Because when you pour so much into something, so much time and effort, it's really hard to see it just melt away.
Yeah. Ugh.
And so, I'm always trying to just take that into account when I'm dealing with someone. I'm not treating an injury, I'm treating a person. And that the best thing that they might need at that moment might just be someone to to just talk to about it and how to reframe their mindset about what's going on.
Yeah, I love that.
And I don't think it's something people realize until it's gone.
Yeah, I totally agree with you. I think a lot of people take it for granted. They take their health, they take their youth in a lot of cases for granted until things start showing up that really bring you back down to reality. And that's where, again, like I've just had to train my training mindset used to be just literally lift as heavy as you can, try and gain weight, try to be, and I've just completely switched my mindset. It was hard. It took me years, even as a professional doing this. How many times, and Catherine knows, would I come back from the gym and just be like, what happened? Like, I got under 400 pounds again and tried to squat it, and I'm broken now. So, and it took me a long time to just say, you know what am I really trying to do? And what's the risk reward here for what I'm trying to do? And like I said, I work with power lifters who are trying to push that limits because that's what they love to do. And for them, the risk is worth the reward. For me at that time, it wasn't. And for a lot of other people, you just have to have those conversations with them and still try and push towards something without it necessarily being the thing that might be hurting them in the long run.
So what advice can you give listeners about either starting their fitness journey or starting their rehab pain journey?
Yeah, I think the biggest thing that I would tell people, I get calls all the time for people that might have just had, a few weeks of pain or even a few years of pain. And when I ask what they've done, they're like, nothing. I've been scared to do anything. And what I say is you're more than welcome to come in, obviously. But what I encourage people to do is just try something for a 2-week period. I did a post on this on social media. It was like one of the most received posts that I did, which was just try something that you've been doing for a 2-week period. If you don't incorporate walking into your routine and you have low back pain, try and incorporate walking. If you're really scared to bend down and round your back, then, try and get on all fours and almost do like a cat cow, like the yoga pose, and just try and move in a way that you haven't moved. Just do something different and see if that has a positive effect or a negative effect. It could actually be sort of diagnostic in either way. But my advice to people is just move in as many different ways as you possibly can. I think that's a general approach to obviously what could be a more complex problem, is just to sort of attack the problem head on and just start nice and easy and slow. And then don't be afraid to seek the help of a professional. Obviously I don't expect people to come in here and understand a lot of these things. I'm not going to tell somebody like, oh, what do you mean you're afraid of touching your toes? Like, that's ridiculous. Of course they are. If when they touch their toes, it really hurts their low back. Why wouldn't somebody be afraid of doing that? Because they're going to equate that with damage. And so my job is just to really help goad them out of that and at least be a voice of reason to say, no, it's okay to do some of these things under these circumstances. If you experience these symptoms that are a little more serious, then by all means, get in contact with somebody. But it's okay. You can move into that pain a little bit. So I guess it's a long-winded way of answering your question, but I would essentially just say, don't be afraid if you're having a little bit of discomfort. Start to move into that a little bit and just see how your body responds. And then, when you're ready to take it to a next level, find somebody that you think will help provide that guidance for you.
Just a quick question, something you just said. Do you think you had said something like move in as many different ways as you can, or a variety of different ways? Mm-hmm. Do you think, is that like a generally like good advice or a good tip for people in general, is just to like be diverse with the kind of movement that they engage in?
Oh, absolutely. I think it kind of goes along with the other advice of be all over the place in terms of the systems that you train, meaning cardio capacity, strength, flexibility. I say the same thing in terms of movement. Our shoulder, for instance, was made to move in all different ranges of motion. The most common thing that I see is people lose the ability to go over their head, like to either press something over their head or really lift their arms over their head. The simple fact of the matter is throughout their daily life, they are just not required to do that. And people then often don't train that overhead movement. So what happens? Your body essentially shuts down your ability to do that. The body is really efficient in that weird way, and that if it senses that you're really not utilizing a certain range of motion, it'll slowly but surely sort of cut off your ability to do that. That's why sedentary a sedentary lifestyle is like the worst thing for so many reasons, but especially for people with arthritis. They think, oh, I shouldn't move this joint because I have arthritis. It's the absolute complete opposite. The more you move something, the more that you'll almost sort of groove your body into feeling comfortable moving into that range. So, move your joints around in whatever direction they want to move in. You should be essentially doing some sort of movement for them in order to just maintain the health of that joint and muscle.
Mm-hmm. I've heard like movement is like lubrication for like. I know nothing about cars, like literally nothing, but I feel like I can draw a parallel to a car and a human body in terms of how we talk about it. So literally if you talk about that sort of idea, it's basically just think about it as like oil that just lubricate the gears and the joints. And if you let a car sit there for years and you go try and start it, it's not just going to cruise down the road. It's going to be rickety. You're going to hear things popping, cracking. It's the same with a joint. I hear things popping and cracking all the time. Mm-hmm. Mm-hmm. Okay. Yeah.
That's good. In therapy, we say that we're the passenger and our clients are the driver.
Yeah, we love a good car analogy. Well, any analogy. But I was also thinking too about something Elizabeth, our dietitian's like big takeaway as well was kind of around variety, like eat a variety of like different, plants essentially to keep your gut microbiome healthy. And it just feels like that, even in therapy, like the idea of being stuck is so challenging for people. And so again, I feel like there are all of these, like these parallels, these overlaps between all of these schools of thought. We're talking about mind and body, right? And so it makes sense that like, again, variety is helpful across the board.
Yeah, absolutely. I think it's the idea of being like a good generalist in the sense, like I consider myself someone who's in pretty good shape. I work pretty hard at it, but I'll never have the best cardio capacity. I'll never be the strongest. I'm certainly not the most flexible or mobile, but I feel like I'm a good generalist in all those things. I venture into all of them. And I think I'm probably the healthiest that I've been in a long, long time in all facets of health because of that. Mm-hmm. Now, the unfortunate fact of the matter, or fortunate, depending how you look at it, is if you have a very specific goal or a very specific sport, your training and everything has to be very specific. And there's downsides to that as well. It as a softball player. What are you doing day in and day out? You're rotating to one side over and over using one arm to do something. When you train, you're training to do that at the highest level, but I can guarantee you're going to have shoulder problems, and that's just part of the equation. So, and you talk to any sort of a marathon runner or anybody, and pain and dysfunction are part of the equation in a lot of ways. And it's just about, like I said, meeting someone where they're at and where they're willing to go or want to go, and just reasoning with them and being very upfront about how things, will be or might be, and then how we can address them going forward.
Yeah, absolutely.
Well, we do have one more question to ask you, but before we do that, tell our listeners where they can find you. How do they reach you if they're interested?
Yeah, absolutely. I'm definitely most active on Instagram in terms of social media, on Instagram and Twitter. And the handle is the same. It's Apollo PCNY. So that's APOLLO PCNY. And feel free to reach out. I answer DMs all the time. I'm happy to do that for people. I basically view the social media platforms as just a way for me to just spread free knowledge to people and hopefully, at least build some trust within people as well. If people are more, I guess, akin to email, it would be Brett, BRETT at apollopcny.com, that same sort of handle. So feel free to reach out. I'd be happy to provide any sort of guidance or info that I can going forward. And again, thank you guys so much for having me.
Yeah, I can confirm he's a great follow on social media. So, so hit that follow button for Brett.
I am biased, but I can also confirm. So our last question, I know that you're probably familiar with our last question that we end our podcast with every single time. It's our self-care menu. So we want to know if you are ordering an appetizer, a main course, a dessert, or a 3-course meal today or this week. What's on your menu?
Oh, this is a 3-course meal. And I mean, you probably know, I'm probably going to steal Catherine's actually from what it's going to be, but we're going on a trip to Aruba, and I have so much anxiety around taking time off from my business and my practice. But once I get on that plane, it's just going to be recharge time, and the ocean and water just do like absolutely incredible things to my mind. Mm-hmm. So hopefully I come back a little bit more relaxed, a little bit tanner, and I think my patients will probably benefit the most from this time off. So I'm excited for that.
Well, I can relate to having a hard time taking time off, owning a business, and a tan does wonders for me as well. But I don't know, Catherine, if that was going to be your self-care menu item as well, but like, is vacation, like, is what's restorative for you, I guess, specifically, Brett, like, what is that? Like, what is vacation? What is restorative for you on vacation?
I think it's probably just a slowdown of my mind more so than anything. But to tell you the truth, I almost do some of my like best thinking and just reflecting when I know that I don't have to be at a certain place, and really put the person who's with me, like as a patient, before like even myself or my wife at any given point, you know. So it's going to be nice to really just recenter and make everything, you know, sort of recenter the values and everything along mm-hmm. those lines. So it's really just reflective for me, I think, more than anything.
Mm-hmm. And are you a sit by the beach or by the pool all day kind of guy, or are you more of like an adventure seeker? Like,
I do not sit still. Like, this is something I actually had to get really used to when I started going on vacation with Catherine's family. They're sit on the beach, tan, like have a drink type people. And I would literally walk onto the beach with a bucket hat and a shovel and be like, all right, who's digging a hole with me? And this was like last year. This wasn't when I was like 12.
Okay. So you'll have some activities that you're doing as well.
Yeah. I mean, you know, I have to compromise my, but yeah, absolutely.
Well, Catherine, what about you?
Okay. Well, since Brett totally stole mine, I'll just say that mine is a dessert, and it's literally going to be the treats that I'm going to have when I'm on this vacation, whether that's some sort of frozen drink in the sand or eating out every single night, because that is such a treat. Brett and I cook food almost every night of the week. So that's such a luxury, and that's such a treat in itself to just go out and enjoy whatever somebody else is making for me. Mm-hmm. So
that is a treat. Yeah. I need a packing update.
Oh my gosh, it's going so well. Good. Brett, tell her.
It's true. It's going well. I'm very impressed. I, on the other hand, but I really just throw shorts and a t-shirt, into a suitcase. I'll probably end up re-wearing the same thing like 3 days in a row, but no, Catherine, yeah, it's going real well for her.
Awesome. Yeah. Yay. Okay, good. That's like
I've really done it little by little.
Yeah, good. Yeah. Awesome.
What's on your menu?
Oh, I feel like I have the opposite of you all. I have a working weekend coming up, which is like, I'm trying not to get overwhelmed by that. So I'm like, I think what my self-care menu is going to consist of is like a lot of like more bite-sized self-care, like we like trying to really find time to slow down and also build in some quality time with my husband, because we'll both be working a lot this weekend. And I don't know, we work together a lot. And so our marriage relationship can get overshadowed by our business relationship. And so even though we'll spend a lot of time working, I really want to prioritize some time like as husband and wife. Does that make sense? Mm-hmm. Okay. So I guess that would be a little bit more of a dessert, probably still keeping our date night that we always have. And then also like some bite-sized self-care mixed into a busy weekend.
Mm. So you'll just be ordering up a lot of apps.
A lot of apps. My favorite anyway.
Yeah.
Well, I'm looking forward to hearing about your trip and seeing your tan as well, Catherine, when you come back.
We'll see. It's like 50 SPF. all day, every day. So we'll see how good it is.
Skin health, that's important too. But Brett, thank you again so much for being here, for chatting with us today. I will take you up on the DMs. You'll see me there. And so again, thank you so much for all of your expertise and your insight today. And
no, thank you for having me. Well, I know it's a long way, but you're always welcome over here in Pleasantville too. So
hey,
feel free to take me up on that too.
I probably will. Like I said, years of some nagging injuries. So yeah, I'll hit you up for sure. Thank you. And to our listeners, thank you so much for following along with us, for rating, reviewing, subscribing, for giving us that follow on Spotify or Apple Podcasts. Don't forget about our YouTube channel, Revive Center for Wellness, that has so much good content up there. So go check that out. You can follow us on Instagram at ReviveCFW. Check out our website, revivecfw.com. You can follow Catherine at Catherine Van Eyck on Instagram and me at Amy Albero LCSW. And don't forget, you can send us your listener questions to wishingyouwell at revivecfw.com. Until next time, thank you so much. And we are wishing you well.